We are live on Instagram.
All right. We are live on Instagram.
There's our guest. Gonna invite you in. Let's see here. All right. Good afternoon, everyone. We are now live on Instagram and on Facebook. We're going to give everybody a moment to join us, and then we're going to get into it. Thank you for joining us on this Saturday. As you can see, I have a very, very special guest, Councilman Ryan Dorsey, the 3rd District, who's joining us for today's daily briefing. Councilman, thank you for joining us. We'll give everyone another minute and a half to join us, and then we will get started. Thank you, everyone. I hope everyone's staying safe and enjoying your Saturday. So thank you again for joining us today.
Welcome to my living room, dining room, office, art gallery.
That's right.
Zoom conference room, and IG live joint.
That's right. So we have to be safe and be at home at this time. So thank you. Thank you, everyone. We're going to give everybody another 40 seconds, and then we're going to get started. Another 40 seconds, and then we're going to get started. 40. So thank you, everyone, for joining us.
Mr. Councilman, you just had a birthday.
I did just have a birthday.
Quarantine celebrate your birthday?
The only thing I did, Councilman, was I actually went out to Coco's actually to pick up some delivery. Yeah.
Tell us the truth.
No, I went to Coco's.
You went to Melba's and they told you to go 2 steps somewhere else.
No, sir.
I can't.
Yep, just 1 second, Councilman. 1 second. We're having a little feedback here. Give me 1 second. Yep, feedback here. 1 second. All right. So now we are going to get started. Thank you, everyone, for joining us on today, Saturday, April 11th, for our Be More COVID update with Council President Brandon Scott. Today we have a very, very special guest, Councilman Ryan Dorsey of the 3rd District, Chair of the Baltimore City's Council Transportation Committee. We're going to get into a lot of different things with the councilman in just 1 second. But first, I want to give everybody an update on where we are in cases in the state of Maryland and the city of Baltimore. We are now up to 7,694 cases in the state of Maryland, with 756 being up cases in the city of Baltimore. We know now that last week I asked for the racial data and zip code data for the city of Baltimore from our health department and our mayor. That information is now available. And again, we know that COVID can impact anyone, but we're seeing in Maryland and Baltimore and across the country that this is being contracted by African Americans at a higher clip, and that African Americans, we are dying from COVID-19 at a higher rate. So we have to take this very seriously as a community, even double time, more serious than everyone else, because of all the pre-existing conditions, all the health things that we've had to endure in our communities for many, many years. So for all of us, everyone take it serious. But Black people, please hear me, and hear me very clearly and very well. We can contract COVID. The people that are saying that we can't, it's a myth. You will get it. You will die. Someone in your family will die if you don't take this very seriously. However, we also have to understand what we can do. And we know that social distancing is the best thing that we can do in order for us to not contract COVID-19 and stop the spread of this virus. So we are now going to get into some questions with the councilman. I'm going to start, Councilman, by simply just asking you, how are things in the third district and what are you hearing from your constituents?
Thanks, Mr. Council President. Yeah, things are going pretty well. We're reaching out to folks all around my district. We were, because it's re-election time, I had a campaign operation already going, and we had staffed up to be knocking doors for the last weeks of the campaign, and then had to stop. And so we turned to the telephones, and we put my whole campaign team onto just calling people and just asking how they doing, just checking in with folks, making sure that if there's any information that we can share, we're sharing that information. If people need, direct assistance, that we're trying to connect them to those things, and particularly around food. And we've been letting people know what's going on with the election. A lot of people had not got the news that it's going to be a mail-in election, things like that. And we're asking people to make sure that they're filling out the census along the way. Most of the people that we're talking to are just kind of hunkered down. Maybe they got one adult in the family that's at home laid off or working from home, and they got another adult in the house who's maybe an essential worker, things like that. And we got a lot of volunteer resources happening in the community too. We've got some great folks who took it upon themselves to create both a volunteer sign up sheet, like a Google form, and then also like a I need help Google form. And we've been directing people to those things as much as anything else. And so I got my whole campaign team kind of doing that, calling 12 to 1,500 phone numbers a day. And then I got my office staff basically doing the same thing, calling through our log of every person who has ever called my office looking for any kind of constituent service help. So, I'm really fortunate that we got good people on both sides of that doing that. And we're just helping connect people to resources.
Yeah, what kind of things or concerns are you hearing on the office side? Like, what kind of services are your constituents talking to your office staff about? What things are like the high level things that you're seeing at the third district? We talked about this with Senator Hayes the other night. We want to see from you here in Northeast Baltimore, like where I live. Want to see what our neighbors up here are talking about, or what kind of services they are needing.
We got a handful, we got a number of people that are just the most challenging thing is the gap around food for families, like for the adults in the household, food for people like in that middle age bracket, where we got meals that are available for children. We got meals that are available for seniors. And we have adults who may be out of work. Like I was reached by somebody who is a temp worker at Good Samaritan Hospital, and they kept all of their staff workers, but they laid off all of their temps. And so now we got an adult with multiple children, and he's out of work, and he's looking for a way to just have food in the refrigerator for everybody. That's been a challenging one. And then adults that older adults that we don't want them leaving the house to just go to go try to find toilet paper that we know is probably not there anyway. And so in those kind of cases, we do have a network of volunteers throughout our communities that can spare a roll or two, can spare a few rolls, and can drop it off on their front porch. Those kind of things on top of just the regular constituent service stuff. The third district is an anomaly in a lot of ways in the city. It's this very broadly based middle class district. So it might not have some of the deeper need that you find in certain other parts of the city, on average. And so we're still facing a lot of people that just have just kind of the regular constituent service stuff, like, DPW issues, water billing issues. But we do hear from folks who are trying to file for unemployment and who are just having a hard time getting through, just
Yep.
because of the high volume of calls that unemployment is facing right now. Everybody I talk to is saying the same thing. Just, I'm having a hard time even getting through in order to be able to file for unemployment. And we're telling them that what we know is that you got to stay on the line. You got to call every day. You got to get through. Eventually you'll get through. And whenever you do get through, your unemployment pay will be backdated to the first date that you were unemployed. So you will get made whole in that way. But we do know that that's going to be a challenge for people who need that paycheck right now.
Yep, and thank you for that. And we've seen, you haven't seen, but we have here on Instagram and Facebook, we've seen your lovely wife in the background a few times. But tell us how you and your family are holding up, how you guys coping, how you guys practicing social distancing, how are you personally doing and managing throughout this time?
Well, me and my wife are not social distancing, but from others, we are. Now look, even the grocery store now, they got uh lines painted in the aisles, or laid down in the aisles, or arrows rather, to direct people to go one direction in the aisles, to create even greater kind of order, so that people are not crossing paths, and people just not listening to that. And then people, you see people wearing masks, and they think that that mask is fully protecting them, and so they let down their social distancing habits, and then people right next to one another, and we need to keep people informed that, like, just because you're wearing a mask does not mean you're immune to contracting COVID-19, and does not mean that you are immune from passing it on to other people. You may not even have symptoms. So we're just trying to be as cautious, an example of that as we can. We did go to the Waverly Market this morning. The farmers markets are still a really important food access opportunity for people. But even there, people are being really cautious, and the people that we spoke, ran into some friends there. We're having our conversations from 8 feet away.
Yep. And then, and Councilman, since you are the leader on the council on transportation issues, I want to talk to you about some of the stuff that you're seeing across the country and what cities are doing as far as transportation, how to help people in neighborhoods practice social distancing, but also stay fit. I know you're an avid biker. Talk about tips that you have for people that want to stay fit, and maybe get on their bike or rediscover their bike, and what you think the city should be doing, but also what people can do individually to do that to stay healthy.
Yeah, look, this is a good time in general for anybody that thinks they might be interested in making that trip to the grocery store on a bike, making that trip to the Family Dollar or whatever on a bike, to get out there and do that, because there's so fewer cars on the road right now. We know in general that that people bike more when they're given a safer environment to do that. And so right now it's a little bit better, but still there's a false sense of safety. There are still cars on the road, and they might feel even more entitled and more empowered to drive however they feel, because there are so few cars on the road. It's like they just dominate the environment as individuals. What we should really be doing is giving up some of that space for cars. If you go around Lake Montebello, for example, right now, half of the lake is closed off, so there's no cars, but there's still cars on the other half of it. You might have 20, 30 people walking or biking around there for every one car that comes by. And for some reason, we as a city have not closed off that side of the lake in order to continue to give that priority to that one car every couple of minutes, instead of giving space for people who could otherwise be properly socially distancing on that east side of the lake. We should be closing that off. We should be closing off other sections of streets, even just lanes. Take up half a street for cars, but give the other half to pedestrians and cyclists, and make more space, because Now, like I said, just everywhere you go around the city, there are more people walking and fewer people driving cars. We should be affording space appropriately, particularly in parks too. You know, we got parks like Druid Park and Patterson Park, or even Lake Clifton Park, and up here Lake Clifton Golf Course, 32nd Street. We got streets running through parks, and we can't even seem to get the mayor's office to make a call to close off those streets yet. I would really like to see the mayor's office step up and actually close off these streets.
Yep, thank you. And just for everyone out there, we're streaming live on 2 platforms with a guest for the first time. So we may have some technical difficulties. Councilman, you should turn the volume down on your phone and listen to us simply on your computer.
I got the computer volume down.
You're good. You're
all
good.
the way. I can't turn the volume on my phone all the way down. That's the problem. I can't turn it off entirely while I'm on the Instagram live. I don't know why.
It's at a good point. It's at a good point. And we are live with Councilman Ryan Dorsey. We're gonna get into, and remember, you can always send your questions in, and we'll get to your questions in just a second. I see that some are in, so if you have more questions, make sure that you get those questions in. I wanted to give you guys the updated info. Councilman Dorsey mentioning the unemployment issues. The unemployment insurance claim center hours have been extended to 7 a.m. to 6 p.m. Monday through Friday, so that you can now be able to do that. And we're going to put the information out for you again at the website is mdunemployment.com, mdunemployment.com. The phone number is 410-949-0022, 410-949-0022, and again, mdunemployment.com. So thank you for bringing that up. This is a question, I guess I'll take this one. First question, Councilman, is why aren't we mandating corner stores and liquor stores have hand sanitizer and information on COVID-19 posted? Well, a few things. One, there is some work being done about making sure that COVID-19 information is placed in businesses. We've been working with our colleague Chris Burnett from the Health Committee. The chairman is leading that effort. He actually spoke to the council members today, but also remembering that hand sanitizer is at a premium. It's very hard for anyone to find hand sanitizer, but stay tuned. We will be talking about more things that we're going to be trying to push our businesses to do. And the councilman even brought up earlier today during our time to further social distancing. So that's, again, another reason for us to remind you that seniors have special hours that you can find on our Be More COVID website, our Be More COVID asset map, bit.ly/Be More COVID map, bit.ly/Be More COVID map. And then also reminding that we should be shopping for seniors, those of us who are younger and more healthy, at every opportunity. We should be doing that ourselves. We should not be forcing them to shop when they don't have to. Councilman, a question for you. As, again, someone who is normally someone who likes to be out and amongst the people. What are you doing now to communicate with your friends, your constituents, like in a digital fashion? How are you, a natural extrovert, dealing with this COVID-19 crisis?
I probably present a little more as an extrovert than I actually am. I'm pretty cool just being at home, like in the zone, trying to get some work done, like all day long. But like I said, we're reaching out to a lot of people. So I am just talking to a lot of constituents, and that kind of fills that social need for me, I guess. But I just try to stay in touch, man. You got to stay close to family. You got to stay close to your friends. You make those calls. Even if I'm only making like one of those calls a day, I'm staying in touch with somebody, checking in on them. I've talked to friends in LA, Philadelphia, New York, and around Baltimore City, Baltimore County, just checking in, see how they're doing in different places. And people, got all kinds of different life circumstances. I got a friend who's pregnant out in LA. I got a friend who lives in the woods with 3 kids and works from home anyway, in Philadelphia. And, people got all kinds of different circumstances and they're kind of adjusting differently. It's interesting to hear from them.
Yep, and we got a couple more questions. Someone asked, "How do I get enforcement in my area?" So, if you're talking about enforcement on a business that's open that's not supposed to be open, that's a 311. That's a 311 call that you can make. So please make sure that you make that. And if it's some kind of emergency enforcement, of course, that is always a 911 call for you to make. Then the next question that we have here is, why can't the liquor stores close? So I think that this is something that we have to understand on multiple levels, right? First and foremost, we know that in many of our neighborhoods across Baltimore, these liquor stores, these corner stores that have a liquor license, are the only place where people can get food, fresh food, all of that, and all of the stuff. And then also, as you continuously hear me say over and over and over again, right now, we do not have the amount of testing we need anywhere in the country, and we can't have our hospitals overburdened with people. And we know what will happen if people who are addicted to alcohol can't get their alcohol. They're going to be sick. They're going to end up in the hospital. We're going to be helping COVID to spread because we're going to be burdening in our medical system, which we know we can't do right now. So this is why they're open for multiple reasons, including public health reasons and also food access reasons. Someone said, "What's happening with the officer coughing on the people in the neighborhood?" This was a video, of course, that was unacceptable. I actually was the person that reported it to the police commissioner. They have to go through their process as guided by Maryland state law. And I will, from my standpoint, make sure that you guys are updated throughout that process when things are given to me that we can share publicly. Someone says, "Is there going to be a time soon when barber and beauty salons can open, especially the ones in suites where there can be 5 or less? That's an essential service in the Black community. Most of us don't have wash and go hair." No, that's the reality. They will not be open until it is safe for people to do that. I know we've heard me say this. People have heard me say this before. If you look at my hair, it's kind of long. I'm giving myself a little shape up. I'm going to have a little fro because it is not safe for us to get our hair done or our hair cut unless someone who lives in our house is doing that. We cannot. My cousin is my barber. And because I don't want to put him at risk, I don't want to put anybody else at risk that he will cut their hair or vice versa, I'm not getting my hair cut. We understand how tough this is. Right now, we also have to understand that where are we going? Right? Most of us are going to be at home unless you're folks like me who have to do essential jobs and have to be out. We essentially just have to bear with this, and we're going to have to see this as the reality. If anyone is coming to your house to do your hair, to cut your hair, I'm going to tell you that they're putting you and your family at risk, and you should question if that person really cares about you, because no one should be doing that in someone's house right now, because they may love you and they may not even know that they have COVID-19. They may be asymptomatic and then pass it on to you, who can pass it on to your child or your parent who lives with you. So thank you. Let's see, there's another question coming in right now.
There was a question about the buses.
Yes.
And how,
go ahead, Councilman.
How packed people are on the buses. That's a big challenge. I mean, they've reduced some of the bus service. So there are actually fewer buses on the road. Even though there are fewer people riding the buses, it means that they're going to be packed into, the buses are going to be packed tighter. And even under the best conditions, it's not like you got six feet unless there's only,
Right.
4 people on the whole bus. And that's not likely to happen in most cases when we got essential workers. I got to give a shout out to all all the underpaid and underappreciated essential workers out there,
All
especially
of them.
folks that are
Exactly.
like members of 1199 SEIU. These healthcare workers are some of the most overlooked people in healthcare environments. These are the people that are cleaning the rooms, making the beds, moving supplies around in hospitals, people that are working in our
Nursing homes.
nursing homes where we know that we've had massive outbreaks.
Yep, I actually
People that are
visited
on
one
the
with
front
in your
line.
district the other day, handing out hand sanitizer on Harford
And
Road to the 1199 workers.
yeah, and so these folks, these are the folks who are riding the bus. These are the folks who are riding the bus, and we're facing a real challenge here with ridership being down and with funding having already been short on the buses. We know that there wasn't even enough service happening in the first place. This is all the more reason why the city should be shutting down some sections of streets to cars so that we can get these people out. Maybe some of these people will ride a bike at least part of the way. You could put a bike on the front of the bus. So just creating more opportunity for people is really important there.
And talk about that, Ryan. You ride the bus a lot too, man. So have you been not riding the bus throughout this crisis? How have you been you've been traveling yourself? Because I know
Mostly,
that that's important
mostly
to
when I
you.
ride the bus is between home and City Hall. I'm fortunate that I have a pretty convenient ride where I just walk 2 blocks from my house and it drops me off 1 block
Right.
from City Hall, and I never have to have a transfer.
Unless it's raining and I have to bring you back home.
Well, rainy days is when I actually ride the bus more likely because I don't like to ride my bike in the rain, but that's my main, my bike is my main way of getting around. But we do have a car in this household, and I got my old car parts mug here. Um, but so I do get around in the car. A lot of time when I go to the grocery store, I drive the car, and that's so I've been doing that, mix it up.
Yeah, and we're still taking questions. I know we had another question here. What about the food service workers for the school? Everyone in the school system is getting paid. The school system has said that they're going to continue to pay their folks, and we're going to make sure that we're talking to them consistently and make sure that those folks are being paid. We want everyone to do it. That's why we're also advocating at the federal level too. We have to make sure that everyone is made as whole as possible. And yes, of course, we have time for a few more questions. So please get them in there. Councilman, when we talk about COVID-19, if you had to say 3 things to the citizens of Baltimore, 3 things about COVID-19, what would they be, and what would you say to the citizens?
Well, the first thing is just continuing to remind people that you and the people that you may be interacting with can have it and not know it. You can be transmitting it. You can have it transmitted to you and not know it. And that means that you can have it transmitted to you and then transmit it to somebody else and not know it ever. So it's really important to take every available precaution. 2, a mask is not a surefire way of not getting it and of not spreading it. And so even if you are wearing a mask, there's a lot of opportunity for error in that. And you really have to continue to socially distance. And the best way to remain socially distanced is to stay in your home to the absolute extent as possible. And the third thing is that we don't know how long this is going to go. We have to be prepared here to accept that this is our reality for the weeks and months ahead, and that if we stop this too soon, that we could see a massive spike again, and we could be climbing towards a peak a month from now, just like we are climbing towards a peak a week from now. Well, and to the extent that we fail to take this as absolutely seriously as we have to,
Absolutely.
are we going to, see ourselves in an even continue to be in a detrimental situation?
Absolutely. And I want to give a shout out to someone watching, a councilman that you and I both were very fond of, Mike Hilliard, the newly retired Mike Hilliard. is on the live feed today, watching us live from home. So shout out to Mike Hilliard.
Man, we
We
got
have
a lot of amazing people on here watching. We got our colleague Zeke Cohen on here.
Zeke.
We
Zeke
got
beat you to it too, Ryan. He was on earlier this week, so he beat you to it.
Well, I
He
also
beat you
want
to
to
it.
give a shout out to my man Quentin Herbert, the HR director for the city here and a 3rd District resident.
Oh, right.
He's on here, so shout out Quentin.
And then we have a few more questions. So someone asked a question, what about social service? You should send us a direct message so we can get even deeper into that. So there's another question about why basketball hoops haven't been taken down. If you know of that a location, please send that to us in a direct message. We'll get Rec and Parks on top of that. Next question was, why are they giving out parking tickets when you're trying to get to work? Okay, they are giving out parking tickets in very, very limited situations right now. So like if you are blocking a fire lane, if you're blocking a fire hydrant and a no stopping sign, places like that, you'll get a parking ticket. Pretty much other than that, they're very relaxed, but they have to still do that in those safety areas because we need people to be safe, especially as we're in a state of emergency. And I don't know if Councilman, if you want to talk any more about that.
You can see a full list of the changes and modifications to services for from not just DOT, but the housing department, DPW, and other city agencies on the city's main website, coronavirus.baltimorecity.gov. Is that the correct URL?
Yep. And then they also, Ron, they can actually find it. All of that stuff is available on BaltimoreCityCouncil.com and just click COVID-19 as well. We put all of the information there for all of you. And just reminder that you can also catch the Councilman and I live on Monday as we have our second digital virtual council meeting. That'll be live on charmtvbaltimore.com. And you can see that on channel 25 on TV as well. So be sure to check that out. We also want to remind everyone that we are going to continuously communicate in this fashion. So make sure that you're getting the latest information about COVID from us on Facebook, Instagram, and Twitter. Another question, last question is, why are police and firefighters given those terrible options and they actually on the front line? So this is something that has came up over the last couple of days. Actually, that information was given to every labor union with employees that work for the city from the mayor's administration. Let me just start off by saying that this is not something that the city council has any dealings with. It's solely administration function. But what I can tell you is that we know that we're going through a crisis right now. We know the fiscal impact that it's going to have on the city, the state, and the country, really. But what you can and bet on for me is that before we talk about laying off anybody or furloughing anybody, no matter where they work at in the city of Baltimore, when this is exactly none of that will be on the table as far as I'm concerned until we have looked at every other option, because we need to keep our workers working, because it's not just about the police and the firemen, those great frontline service employees, but it's about the trash men, the people that work in rec and parks that are still giving out this food, the folks at the health department, the folks at housing, the individuals across the city that are still working. We're going to make sure that as we get to the budget, that we are trying to know and recognize how serious this crisis is, but also understand what we need for the citizens of Baltimore and for our workers to be as made as whole as possible. Question for you, Mr. Dorsey, from one Councilman Zeke Cohen. Mr. Dorsey, will you regrow your beard during
Never
COVID?
again. Never again. I got a razor, man. I got a razor and I know how to use it. Look, man, that was a one-time mistake. It's something that you never had to do again. That's a year of my life I'll never get back. No, for real. No, that ain't happening. But there was a question there, a follow-up from my good friend Brett McCabe. Yeah, you know, the Department of Transportation said that they've been looking into whether or not to do some street closures. I already talked about this a little bit. I really think that this is probably a decision from the mayor's office that that probably the mayor's office needs to be hearing from folks, that, you know, maybe they don't think that this is a priority. Maybe, you know, they think that this is too hard to deal with. I know that it should be very, very easy to close off at least a couple, you know, a certain number of areas: Patterson Park, Druid Hill Park, Lake Montebello, Lake Clifton. You know, it should be very, very easy to make the decision and actually execute the closing of certain areas. To me, it does not seem like this is a priority to the administration. And so I would say that it's the mayor's office that needs to hear that, because in an emergency, in a disaster situation like this, you know, you have to be able to look to the administration as the leader that's supposed to be rallying and coordinating all of the various agencies and giving marching orders. It's not enough to have you know, too many cooks in the kitchen.
Yep, thank you. And that was a question. So someone asked about the 21215 and it being the highest zip code. Why is it not shut down? Listen, this is again, we have this essential shelter in place thing in for a reason. We need everyone understanding that, but it's also about the reason why I asked for the data in that fashion. And so that now we can pressure our agencies, our health partners to focus on those areas and focus on educating and focus on prevention and how we're going to keep people healthy and safe in those areas. We have to allow people to do their essential stuff, right? But again, this is why we have to take this very seriously and limit our exposure. Before I close this out, Councilman, thank you for joining us. Do you have anything else that you would love to say to the people of Baltimore City right now?
No, you know, just stay inside and stay close to the people you love, whether it's you know, in the house or whether it's over the phone or whether it's on the Zoom or, you know, whatever, FaceTime or whatever. I want to give a shout out like you did to Mike Hilliard. He did just send me a message and say he is very glad that I'm not going to be regrowing the beard. And that's a good reminder that I'm really thankful for his service. We had planned on having him into City Hall to present him a ceremonial resolution for all his years of service at Harbell. And some circumstances changed and we weren't able to do that. So I do just want to really express my deepest appreciations to Mike Hilliard for all his service to Northeast Baltimore.
Yeah, maybe we'll do it. Mike, I know for a fact that Mike knows how to use Zoom because he did one with me the other day. So maybe we'll give him his resolution via Zoom and have it done that way in front of the whole digital world. He'll get a good kick out of that. Actually, I gave Mike a resolution. One of the last things I did before we had this shutdown here. So you know. And then Ryan, I also wanted to ask you, like, for you, how you're communicating with your family, you know, this weekend for many folks is a big weekend, but how are you communicating with your family and your family throughout this time?
Well, my parents live a half a block down the street. So usually I just open a window or open a door and shout and they can hear me. No, I get a call from my mom pretty regularly. I was out walking in the neighborhood yesterday and I saw her driving by, and we stood, even from my own mother. You know, my mom is 74 years old.
Oh, wow. She doesn't look it at all.
Yeah, man. So I keep my distance from her. I had to go pick something up from my parents' house last week, and I made them leave it on the front porch. My dad, who's 73, was like, he was kind of, you know, snippy when I wouldn't walk up to the front porch.
I want you to say that again, Councilman, because I said that consistently. You had to pick up something from your parents' house that live right down the street from you. And what happened?
My dad came to the door and opened it like as I was walking up to the front porch, and I stepped back down the steps. I was like, yo, I'm not coming near you, man. You're 73 years old. I don't know if I got this thing. Like, I could be transmitting this thing to you. I have no idea. I'm not coming anywhere near you. As long as you got that door open, I'm staying right here at the bottom of the steps, man. And he was kind of like, fine, and closed the door. I was like, man, you got to take this seriously. And
that's right.
you know.
That right there, everybody, is exactly what I'm talking about. And I hope my mom is watching, because I had this conversation about folks going over to my grandma's house in the same way. You got to be responsible. And I want to
My-
tell everyone that got to do it.
one of my community leaders over in the Paring Lock community told me last week that one of his neighbors, who like him is in his 60s, had a birthday, and he invited 4 of his friends over for some beer and Hennessy and to play some pool.
Oh,
And you can imagine how close people are going to be, close quartered, if they're playing a game of pool. Like, this is not a good idea. And in that circumstance, also, what I was told is that the homeowner, the birthday celebrant's wife, is recently recovered from cancer, and that the next day they had a children's birthday party at the house. Nothing about any of this circumstance is okay. This cannot be happening. You are putting people's lives at risk when you do these kind of things. Do not do this. Don't be bringing people into your home, whether it's to deliver a dinner, or whether it's to get your hair cut, or whether it's just to say hello and catch up over a cup of coffee. Do not be doing this right now. Do that from 20 feet away from one another. I've seen people having conversations, neighbors, sitting in lawn chairs in their own yards.
that's right.
Each of them 6, 8, 10 feet on opposite sides of the fence, sitting from 15 and 20 feet apart. This is at least reasonable. This is at least sensible. Like, you got to take this thing seriously, man.
Yep. Everybody, I couldn't say it better. I know, listen, we know, and I want to say this because tomorrow is Easter. We have to understand, if you're thinking about it, don't do it. Don't have a whole bunch of your family members over your house.
Right.
Do it through Zoom, do it through Google, do it through whatever create a Facebook group for all of y'all to go in there and see. I don't care how you do it. Don't do it. As I say consistently, nothing is paining me that I will not taste my grandma's potato salad tomorrow. Nothing more is paining me throughout this crisis. But I know it's irresponsible for me to do that. And we have to take this very seriously, because this virus is taking people away from here. And what we want is for Baltimore to make it through this, and make it through this with the least amount of people contracting and dying from this virus as possible. This is a serious thing. This is why we can't get our hair cut or done. This is why we have to practice social distancing at the store. This is why we have to make sure that we're helping our seniors and people with pre-existing conditions out, because we need everyone to do this so that we can stay safe. So thank you, everyone. Thank you, my good friend, Councilman Ryan Dorsey, for being with us on this live. You know that I love you dearly. I will see you at the council meeting virtually on Monday. Maybe I'll drop past your house and honk the horn. Stay safe. Enjoy, sir.